What's up, everyone? Brock Stoltz here, along with Dr. Matt Maun, and we figured for episode 4 and 5 it'll be a two-part series, or 5 and 6, yeah, on kind of how a session goes with Matt. And since I am actually a little messed up right now, he's going to assess and then give me some exercises to help me out. So, Matt.
All right, guys, so I decided to take a vacation. While I was on vacation, Brock here decided to hurt himself doing some jiu-jitsu. So, first part of our video, episode 5, is going to be focusing more on his low back, pelvis, sacrum, all that good stuff. And then we're going to, for video 6, work more thoracic spine and look at his cervical spine, because he's got some issues kind of the whole way up the chain. So first thing we're going to do is we are actually going to assess the alignment of Brock's sacrum and his pelvis here. So what we're going to do is we're going to have Brock lay face down. And what we're going to do here first is we're going to come in and just kind of set his pelvis. And then we are going to find the PSIS. Okay? This is 2 little bony prominences right here. Okay, and now you can see they're not quite level, and there is debate on how accurate you can be with palpation, but knowing Brock's history, this is pretty consistent. This is something that he's dealt with in the past. So we're going to look at his PSIS, and it looks like he could have some sort of rotation. Okay, so from there, we're going to check his sacrum. So we right now are looking at his sacral sulcus, so that sacral base right here. And what we're feeling for is symmetry. So is one deeper or more shallow than the other? And it feels like he is, to me, he is more shallow on the left here. Okay, so this side, that bone kind of pops into my finger a little sooner than this side, where I can sink through a little more soft tissue. From there, we're gonna drop straight down to the ILAs, okay? And we're gonna again look for symmetry. And as you can see by my thumbs here, he is not symmetrical. Okay, so if we pull out our skeleton here, what that's showing us is that this part of Brock's sacrum is rotated this direction. Okay, so it's rotated to the left, and then also side bent to the left. So he's kind of sitting in a position somewhat like that. All right, so now to figure out kind of which side is the side of dysfunction, we're going to just make a quick joint mobility. So this is called the flick test. Okay, I'm just going to come on in, and I'm just going to feel that mobility. Then I'm going to come to the other side. Feel the mobility here on the other side. And to me, this side, this left side, feels like it's not moving quite as well as the right. So to correct this, what we're going to do, we're going to come in here, we're going to stabilize. And I'm just going to give a little pressure right through that sacrum. And I'm going to have Brock take 5 deep breaths for me. So breathe in, good, and breathe out, good. And what I'm doing is I'm just maintaining pressure here. As he's breathing, and that's just mobilizing that sacrum a little bit. Okay. And then from there, again, I'm going to reset his pelvis here. Back in, and I'm going to recheck that alignment. And that looks a little better. Again, research is questionable about how accurate you can be, so we're going to check here as well. That feels better to me as well. And then we're going to drop down here, and that has not corrected yet. So this is the next thing we're going to correct. Okay? So again, we're going to do something similar here. We're getting real close and personal here, so Brock, go ahead and take 5 more deep breaths for me. And again, I'm just maintaining this pressure here with my right hand. And one more. Good. Reset his pelvis here again. Check our landmarks again. Make sure they're nice and lined up. That looks better. Now, it's not quite perfect, but it is definitely better. Okay. Now the other thing we noticed with Brock is he's got some, likely from this, he's got some hypomobility through his lumbar spine here, where this left side is kind of stuck in extension, so it's stuck down and back. Okay. Now that is, again, likely a compensatory movement from everything he's got going on here. So what we're going to do next is have him lay on his right side. And we went through a full joint mobility assessment here before we started the video, where we assessed flexion and extension throughout the lumbar spine, as well as rotation and side bend. Okay. So we're going to make sure Brock's nice and comfortable here with a pillow. What we're going to do is we're going to bring him up. Straighten that bottom leg for me, Brock. Good. Bring him up here. And we're going to rotate him down to that level that's not moving so well. So hold on to your wrist there. Good, and just relax for me. Now what I'm going to do is I'm going to roll him towards me. Try to get on skin here. That's it. All right. Go ahead, flip on back over to your side. Facing me. We'll give you this still. I'm just going to reassess. Yep, just relax. Just going to reassess some joint mobility here. And this is not the typical way they teach you to do joint mobility in school, but this is a way that I've learned kind of through some continuing ed classes. And that feels better to me. Now, after this, we are not just going to do that mobilization, those grade 5 mobilizations, and call it a day. Nope, lay back down. The next thing we're going to do after this is some neuromuscular re-ed. We want to make sure that those corrections that we did stay where they are. So one of the things we'll do is that transverse abdominis set that we showed in video 1. So Brock's going to breathe in, breathe out. Nope, relax. Normal breath in. Breathing out like he's blowing out candles. Pulling in the belly button at the same time. Pulling straight down. He's going to hold that. And then we're also going to encourage a pelvic floor contraction, which is typically known as a Kegel, to help stabilize that pelvis and that sacrum. Okay. Knowing Brock's history, after this we would probably also give him some clamshells, because we know he's got some weakness in through those hip abductors, and those are going to help stabilize everything as well. All right, so tune in. Part 2 is going to be working on Brock's thoracic spine and his neck.